All right. Hi, everyone. Thank you so much for being here. My name is Probnor. Something we like to do at the beginning of our meeting and anytime anyone's going to speak is just provide a quick verbal access image check. So, for example, I would say I am a South Asian woman with black hair and I'm wearing a navy blue t-shirt. And that's kind of how we like to get started. But today we have a really exciting program. We're going to have our guest speakers discuss an assortment of conditions. Specifically, this month is dedicated to myalgic encephalomyelitis, cystic fibrosis, and PANS/PANDAS. And yeah, we're super excited to get going. I know we have some people in the waiting room, so they're just trickling in, but as I said, for the access check, we just ask that you provide a verbal image description. And in terms of captions, you can turn them on in the bottom panel by clicking the CC button. And if you have any other accommodation needs, you can put them in the chat or you can message Sarah privately, and we'd be happy to do our best to accommodate them. And quick disclaimers, we like to say at the beginning of our presentation, we are not offering medical advice. If you are concerned about any of these issues, we ask that you please do talk to your doctor. And each person with a condition is unique. So even amongst individuals with the same diagnosis, everyone's experience is different, and we really try to respect that. And of course, we've done our research and we have some great guest speakers today sharing their experiences with chronic illness and conditions. But we always like to say that we are not experts on this topic. We really encourage doing research on your own as well. Specifically, what we're going to be focusing on today. So the conditions of the month include ME, which is myalgic encephalomyelitis. This is more commonly known as chronic fatigue syndrome or CFS. Cystic fibrosis and PANS/PANDAS, as I mentioned earlier. Specifically, what these stand for are pediatric acute-onset neuropsychiatric syndrome, and PANDAS is pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections. But zooming out a little bit before we get into all that, kind of some context of why we're here. What is Invisible Illness Awareness Network? So we're a 501c3 nonprofit, and our mission really is to raise awareness for invisible illnesses, chronic illnesses, and disabilities. And a big focus of the organization is also to support university students in starting affiliate organizations to become leaders and educate peers and really foster inclusive environments on university or school campus settings for patients and families. But specifically, what we're at today is the Invisibly Aware series, which is 2 virtual meetings a month on invisible illness topics. So typically our first meeting of the month is a very educational, informational presentation. We had that earlier in February. And our second meeting is what we're at today. So we have some wonderful guest speakers lined up. We're going to share their lived experiences or sometimes professional expertise on the topic. And that's what we're going to be doing today. And a quick information about our social media. So if you have social media and would like to kind of follow up and stay up to date with what we're doing, we have our Instagram and our YouTube and website linked here. And then also just for convenience, if you want to scan the QR code, that'll take you to all of the social media as well as our newsletter sign up. Finally, before we get started, if you have any questions at all during the presentation, feel free to ask them and you can put them in the chat and we will do our best to answer questions to the best of our knowledge. At the end, we'll also have like a Q&A session where people can feel free to like unmute and ask questions in that way if you'd prefer that as well. So just to provide a little bit of background context in case you weren't able to join last meeting earlier in February, but we had some main takeaways for each of the conditions we talked about. So quickly, myalgic encephalomyelitis, also known as ME. So this is a chronic neurological condition defined by overwhelming fatigue that isn't fully alleviated by rest. And some typical symptoms seen with that are brain fog, pain, autonomic dysfunction, PEM, sensory sensitivities, and unrefreshing sleep. And some treatment and management when it comes to ME includes pacing as well as medications for symptom relief. So really managing symptoms is a big part of treatment. Some mobility aids are also a big part of treatment plans as well as supportive care. And a key takeaway is that ME is not just fatigue, it is a disabling condition that is underrecognized and often dismissed. So for PANS and PANDAS, PANS, as I mentioned, is pediatric acute onset neuropsychiatric syndrome, and PANDAS is pediatric autoimmune neuropsychiatric disorder associated with streptococcal infection. So I'm just going to refer to that as PANDAS from going forward. But specifically, PANDAS is a subset of PANS, so that's important to keep in mind. But specifically, what are these conditions? So a sudden onset of neuropsychiatric symptoms, often triggered by an infection, and symptoms of this condition include OCD-like symptoms, mood changes, tics, restrictive eating, changes in motor skills, and sensory sensitivities. Treatment can often range from infection treatment to therapy to psychiatric medications. And one of the key takeaways, something we really emphasized in our meeting last time, is that there is a big lack of awareness and research when it comes to PANS and PANDAS, to the point where some doctors deny its existence. And so it is often misdiagnosed. So there is a really key urgency towards putting more funding and just inquiry towards PANS and PANDAS. And without further ado, the reason why we're here, we have our two wonderful guest speakers today. Thank you so much for being with us. We have Carrie Niederman and Emily Snowden, and their Instagrams are linked here as well. And if you both want to do a little quick introduction, like a verbal access check, and share anything about yourself before we jump into the questions. But Annika and I will be alternating asking questions.
I'll go ahead, Emily, this time. But access check. I'm white female, brown, gray hair, green top. My name is Carrie Niederman, and I have ME, CFS. I'm a retired veterinarian. Now I'm have converted to being an educator and advocate for this condition, hoping to educate some of the up and coming new medical professionals to really understand this disease from the beginning. So.
Thank you, Carrie.
Hi, my name is Emily Snowden. My pronouns are she, her. I'm 18 years old, and I'm here today representing my experience with PANS. I also spread awareness on PANS and several other of my chronic illnesses like Ehlers-Danlos syndrome and my experience with Lyme, Babesia, Bartonella, POTS, MCAS, things like that on my Instagram and my TikTok. And I am also very passionate about helping people understand what the symptoms of PANS are and how to recognize that in your child or yourself before things become chronic and really hard to reverse.
Thank you so much, Emily. So before we get started, just an overall thank you for being here, for being guest speakers. I know these are really personal experiences, so we really appreciate your time to give to us. And something we just want to remind is that you can share as much or as little as you feel comfortable. This is your story, and we're grateful for your participation. Also, please keep in mind that we are recording this, and this will be uploaded to YouTube. I know we shared the question lists with you. Not all the questions will be asked. We might change the order in which they're asked, so just keep that in mind. And there's no really set order about who's speaking. Whenever you feel like chiming in, you can chime in. And we estimate that we'll be done around 9, just for your knowledge. So our first question is kind of, I know both of you touched on it, which conditions you are talking about today, but we're wondering, can you share your experience living with an invisible illness or chronic illness? So more specifically, some things you might want to talk about are when did you start experiencing symptoms, or a brief description of how your condition affects you on a day-to-day basis.
I experienced a very sudden onset of symptoms. In PANS and PANDAS, it is typically pretty dramatic of an onset, not always. But in my case, it was overnight. It was August 2nd, 2020. My birthday is August 1st, so it was the day after my 14th birthday. And I woke up a completely different person. It was terrifying for me and for my family. But I historically was a little shyer of a kid, had a little bit of anxiety, but I never had any diagnosable conditions other than asthma. And I was so anxious that it was hard to leave the house, having panic attacks all the time and having overnight tics, verbal tics, motor tics that made it very hard to just feel comfortable in public. And in the spring of the following year, I started having non-epileptic seizures. I did not have a diagnosis at this time, so we really did not know what was going on. And I had been told, and my parents had been told, that this was just teen anxiety. So when I had the seizures, it was very clear to me that something else was going on. And that's when I really started to dig into, okay, I need to take this into my own hands because no one else will. And unfortunately, majority of pediatricians, doctors in general, just don't know a lot about PANS PANDAS, let alone feel comfortable bringing that information to you or knowing what tests to order. So my first diagnosis was actually Bartonella, which I was bitten by a tick at some point. I used to go camping a lot as a kid, so I found plenty of ticks on me, but this must have been closer to my onset, and I got all three co-infections, lucky me. So I had Lyme, Bartonella, and Babesia. The rest were not diagnosed till later, but this led us on to that being the trigger of PANS.
Similar to Emily, my sort of symptoms came on very acutely. Unlike sort of the long COVID, which is very similar, has some similar symptoms to ME. Or I was diagnosed back in, or developed the condition back in 2009. So it was chronic fatigue syndrome was really the term that was used, but it was overnight. I felt like I had the flu, but I felt differently, that I had a lot of leg pain. So I did go see medical care that evening. And they just thought I had a fever. So they thought I had the flu or had a viral infection. They said, go home. And really by the next morning, my body felt differently. There was definitely a noticeable, whatever had happened overnight. And in that first couple of years, I was very, very tired, much more tired than I am now. I've been able to manage it for a number of years. But I think the biggest thing is that it's better understood now that your energy level is just not predictable. And I would think that that's the overriding message that I would say, that's the tricky part, so that when your day is always navigating that off ramp of that backup plan, because you're going to run out of, your mitochondria is going to run out of energy at some point, and you never know when it is. And that and the sort of the challenge of the word fatigue, I think I'm glad it's gotten closer to MEs becoming more popular, because I think there's just a lot more stigma attached to being chronically fatigued. And I was never diagnosed. It was a diagnosis of exclusion back then. I mean, I think the criteria become much more identified, but it still takes 6 months. You have to have 6 months of fatigue to sort of start to get in that category, and that's a long time to feel really lost and afraid because your life is suddenly flipped and changed overnight.
Thank you guys for sharing that. Just to quickly introduce myself, my name's Annika. I'm a white woman with dark brown hair wearing a dark blue sweater. Our next question does touch on things that both of you said, but we're wondering if you could maybe elaborate on the journey that it took to get diagnosed. How long did it take for you to seek help after your symptoms started? And how many doctors did you have to see? And did you have an emotional reaction to actually receiving a diagnosis?
I'll go ahead. As I said, I never got a formal diagnosis, but I did. I probably saw 6 or 8 different specialists over a period of a number of years, and I think I sought treatment or trying to return to my active self for about 8 years, and then I realized I was just not getting anywhere. I think it was fairly typical. I mean, when you go into a physician and you look healthy, have normal test results, and yet you feel unwell, you get bounced around a bit. And that was, you know, I saw some infectious disease in individuals sort of looking for the things that Emily came down with tick-borne because of my veterinary work. Saw a rheumatologist, neurologist, sports medicine. That's often a frustrating piece, because a lot of individuals with my condition were just labeled as being out of shape, and so there's an exercise that is part of the sort of, oh, you're just tired, you just need to sort of get more active. And then luckily there's much more awareness on how harmful that kind of parameter is. So I actively, as I said, actively sought care or treatment for about 8 years, 8 or 9, and then I've just managed it on my own pretty much.
For me, like I said, presented with mostly mental health symptoms, and the tics. And so, at the time, I was healthy before that, so I was only seeing a pediatrician. We worked with this pediatrician for a while, and obviously, when I presented with mental health symptoms, the approach was mental health treatment. So I was put in therapy, and I started an IOP, which is an intensive outpatient treatment, typically about 4 days a week for about 3 hours a day. And I just continued to get worse. I had to be removed from the IOP because of social anxiety, which is a big thing with PANDAS, and separation anxiety, specifically to my mom. And I started really questioning my pediatrician when I had the seizures, because a healthy person does not just suddenly start having repeated seizures. That is a red flag. And at the frequency that I was having these seizures and do have these seizures, it's every couple days, And so that's not something that I wanted to take lightly. So I was very big in advocating for myself with my parents and with my doctor of, hey, I think something is really wrong. So I was sent to lots of specialists, and their favorite thing to do is say, your problem is not in my lane. Let me send you back to where you came from. So that was very frustrating. And I was tested for Lyme by my pediatrician, but the standard test that they use for Lyme, and I think that the CDC recommends, has a huge amount of false negatives and does not pick up on the antibodies in your bone marrow, because the bugs love to hide there, especially if you had it for a while. So I actually discovered PANS through someone else's Instagram account, raising awareness for it, which is why I started my own account, raising awareness for that. And I began talking to this girl, and I actually went to see her doctor, who's now my neurologist, because we live somewhat close by. And this doctor found the Bartonella, and then I went to, I see Dr. Kaplan with the Kaplan Clinic for Integrative Medicine, and I saw him, and that was the first time I felt really seen by a doctor. He spent a good 2 hours with me and my parents in the initial appointment, just asking all kinds of questions about from when I was a baby up until now. And without me saying anything, he was like, I think you have PANS. It is also often called autoimmune encephalitis. So that term was used a lot at first, but it is the same thing. One's just kind of an umbrella term, and PANS is more specific. But I really felt like I was screaming for help, as I didn't know what was happening to my body, and I was scared I was dying, because seizures are very scary, and symptoms I was having, the depression, all of that was terrifying for me, and I know for my family. So I was very big on advocating for myself, and I got diagnosed using the Cunningham panel, so that there was hard proof of the inflammation in my brain.
Thank you so much for sharing. I think both of you really highlighted the mental load, especially when it comes to having to just constantly advocate for yourself when it comes to chronic illness, and how much often like gaslighting and disbelief there is that goes with it, and how that creates such an emotional toll. So really appreciate you sharing that and sharing that vulnerable aspect of things. I know Carrie and Emily, you touched on this a little bit, but when we're thinking about on a day-to-day basis, since you've gotten your diagnosis, what challenges would you say you're facing in your daily life? So physically, emotionally, socially. I know you both have mentioned some symptoms that you go through, but if there's anything that really sticks out for you, and also, has your condition taught you anything about yourself?
The biggest things that I deal with definitely change depending on what my body decides to throw at me. But for the past 3-ish months, my top kind of issues have been psychosis and violent hallucinations. It is not uncommon for me to see, hear, and physically experience touch that is not there from violent people trying to attack or kill me, which is very scary, and is very difficult for my parents to comfort me during that, because that's not something with PANS where you should be taken to a hospital and put in a psych ward. Also, I know they had mentioned this when talking about the symptoms of PANDAS, but eating is a big issue for me at the moment. Just sensory issues play a huge role in what I eat and how often I can eat. And there have been times where it's been days that I haven't eaten. So just I've been working with a dietitian and a therapist who specializes in eating to really increase intake in that aspect. And then the seizures are still very disruptive. And recently my tics have kind of come back, but they were not an issue for like 2-ish years. And my chronic pain is really not managed. So I was in the ER 2 weeks ago for that. And I experienced excruciating pain where I'll be screaming. And it's very difficult to find a rescue medication that helps with that. And my illness has taught me so many things about my life that I value so much. I wish I didn't have to learn them this way, but I am very grateful to have learned so much about myself and about the things I value. And I think that it has really taught me how to be compassionate and empathetic with other people, and realize that you never know what someone is going through just by looking at them, or having a quick conversation with them. You never know why someone is acting the way that they are acting. Or, you know, if you see someone having tics in public, you don't know what's going on. So just being able to kind of extend that grace to other people and have that compassion for everybody in a developmental period of time in my life was really great. And I also realized that I find so much joy in helping other people, and I love receiving messages through my social media that have told me things like, you helped my child get diagnosed. You inspired me to write my book on chronic illnesses. Just things like that. So I've discovered my passion for advocacy, and I want to become a physician's assistant. So my experience with having a PIC line in the past and being my own nurse has brought me to that career path.
Thank you, Emily. Boy, that's hard to follow, even as a fellow chronic illness patient. Because I will say that I am been fortunate as I've watched others with ME that I have a mild form. So I'm much more functional than many, which I'm very, very grateful for. But there is a I think the struggle on a sort of daily basis is that until you find the individuals in your life who believe you and then recognize when you're having a down moment, it's a constant conversation to educate. And this is what's happening. And there's a vulnerability for me when my energy drops, my voice changes, and I get a little irritable and I get short. And that will pass, but it's off-putting, and I'm self-conscious about it. So those are irritable moments where people are like, well, where did that come from? And so I try to educate people in advance that this might happen, or that I need to have you turn off the commercials for the TV because it's too loud, or that I can't do all of that technology at once because it's going to overload me. So there's a lot of education and repetition in that education. And so there's a lot of loneliness to this that you're trying to have people be understood is really a foundational piece. We all want to be understood for various things in our lives, and this is one. And like Emily, I know the disease has made me more aware of others. And it's also made me really believe in my own body and what I feel and what that is real, even if it's questioned by others, that I know that this is how I can function, and you just have to be your advocate for yourself all the time. You hope that you have somebody in your life who will help you with that, but until you do, you're doing both tiers. You're living the condition and you're advocating and trying to educate people. So it's a big lift.
Yeah, I definitely resonate with the loneliness. I graduated high school last year in 2024, and I'm taking a gap year because I'm in too much intense treatment to be in college or live independently. But my friends are mostly in college, and so there's that big barrier. My sister is one of my best friends, and she is also away at college, so it's really just me and my parents and my therapist. So I just want to be seen, and I feel like I'm either perceived as fine and held to these unrealistic expectations, or I'm seen as just a sick person where all my conversations with people are about sympathy and pity. And I want people to know that we are real people too, and we have other interests and things like that. And we want to talk about other things as well. And we want to be treated like a normal human. And my favorite thing is when people actively try to understand my illness and ask me about it or repost things about my illness. Because if someone you love has an illness, you should learn about it.
Thank you both. Oh, sorry. Do you have more to say, Carrie?
I would, you might ask me later, but I would say, Emily, that I echo for managing a chronic illness, especially, I'll just say for mine, since that's what I know, but having somebody who actively wants to learn about it, and then when I'm out someplace and they know when I give them a word saying, okay, for me it's midnight, which has my own sort of metaphor for my condition based on Cinderella, but I'll say midnight and they know it's time to turn, and they don't question that. And I think that's, we live in an active world where everything goes and moves along, and if you're pushed when you're not, like, oh, come on, just stay a little longer, and they don't realize that will do great harm. And so having somebody who really is that partner, that advocate for you in real time is critical.
I think you both did a really good job of emphasizing how much this impacts you every day, but also how important community is. For our next question, we're wondering if you had any specifically impactful treatments that you may have tried, and what has worked, what hasn't worked, what has stood out to you on this journey.
I have tried so many treatments, and if you do more research on PANDAS, or autoimmune encephalitis, almost all of the things that they talk about, I have done. Starting with the least invasive things and then progressing. But I have not found anything super helpful. My condition has been very treatment resistant, but I have had mild improvement with high dose IV steroids. I also don't have any infections currently, so I had success with the antibiotics I did for over a year, and I did for a period of, I think it was 3 months, I did them through infusions every day at home. So that was like 3 hours of my day. But I have done IVIG, I have done Rituxan, which is typically a chemotherapy medication. I have done the steroids. I have been to residential mental health facilities. I was in a PHP. I'm now in an IOP. See multiple therapists, psychiatrists, and I have found some medications that really help. I take a stimulant for my fatigue, and to help with the sleep disturbances that come with PANDAS, the lack of REM sleep, and also the inattention that is exacerbated. I have ADHD, but PANDAS causes inattention too. And the other thing that I've had a good experience with is, and this is not a typical treatment, and I would heavily suggest that you do your research on this before just taking what I say and running with it. But I have had luck using IV ketamine to help with chronic pain, depression, hallucinations, and that is one of the few rescue medications that does help me in episodes.
I would say that the two things that have really helped me, one, so when I first got sick, I mentioned that I had a lot of pain in my legs. So my upper legs, my quadriceps are where, for whatever reason, they've gotten quite weak, and they throb and there's a lot of inflammation there. So what's interesting for me is that what's been helpful is that I found that icing my legs has really helped, even when I have a lot of brain fog and I get more confused and I'm just very rattled. I have full length Velcro ice packs that I can put on my legs, and 5 or 10 minutes of that even makes my brain clearer and my head clearer. So I did move to a cooler environment 3 or 4 years ago. The heat really exacerbates, so I really try to minimize that. And as Emily mentioned, for me, a big part of my treatment is therapy. I've had a therapist for a long, long time, and that ongoing recognition of the grief of the life you had, the active sort of soul, even though I've had this for a number of years since 2009, it's still there. I think it hits me. I'm in my mid-60s, and I think people still are active. And if I run across a friend or maybe a college classmate that I haven't seen, and suddenly I realize how much more active people are than even at my age. And it's just sort of puts you, it's just a wave of grief that I have, doesn't stay around as long as it used to, but it's still something that's very helpful for me to talk to somebody about it. And so that's part of my therapy long-term plan, is to have a therapist and have her part of the narrative, because she gets it. And I can say the same thing to her whenever I visit with her, and that's okay. And I think that's where I live alone, and a partner or a spouse, they just have to be able to manage that. And the therapist for me has been the outlet that I needed.
Yeah, I think therapy is definitely really helpful. For PANDAS specifically, therapy is not the main treatment, but a lot of people with PANDAS have trauma from the medical things that have gone on, and a lot of the medical gaslighting or neglect from healthcare professionals. So yeah, working on my CPTSD in therapy has been helpful. And I continue to work towards that, but the grief is definitely a big thing, because I never went to a full year of in-person high school ever. I was medically homebound, and watching my friends do that, of course I'm very happy for them, but it is hard, and feeling like my brain is being taken over by this disease, and not knowing who I am as a person, or what my favorite color is, what I like and what I dislike. I go through times where I am so symptomatic that I forget what my personality is. And I, if you ask my family, they could attest to this. I actually made a survey about who I am, what my qualities are, good and bad, and things like that, and made my family and one of my friends fill it out, because I had no idea who I was. And every time I go through a flare, I feel like I have to rebuild who I am again. So that is very difficult.
Thank you so much. I think you both really emphasized what a continuous and ever evolving journey treatment is, and how it can really look different on a day-to-day basis. So in terms of our next question, we're pivoting a little. I know we've talked a lot about your personal experiences, symptoms, the day-to-day. But when we're thinking about external forces, and whether that be the healthcare system, I know we've talked a little bit about that, or education system or workplaces, What challenges or potential support have you faced in these institutional structures when it comes to your condition, accommodations, and just like acceptance? Have you experienced any stigma or discrimination or accessibility issues when it comes to schools or workplaces, or even the healthcare system?
Yeah, because not a lot of people understand PANDAS, and a lot of people have never heard of Bartonella or Babesia, um, which are co-infections of Lyme. I often know more about my conditions than ER doctors do, and I have had paramedics in the ambulance Googling what my conditions are in front of me. And that is scary, because the people who are supposed to be professionals administering you medicine are going off a Google search. And there is a lot of this stigma with PANDAS that you just need to go to therapy, be put in a mental hospital, or things like that. But even therapy has been inaccessible for me at times, where I was essentially kicked out of a residential treatment facility for being too sick and having seizures, and going to the emergency room too many times. So they let me go. And then other residential facilities are not equipped to handle people who have chronic illnesses and mental health conditions. So I've had a lot of issues with that, and even in my PHP let me go for the same reason of my medical issues were too much for them. So I think there's this big gap in our system where people with chronic illness almost always experience mental health symptoms, whether that's a part of their illness or secondary to their illness. And there are not really a lot of places that are willing to treat someone like me who can go unconscious somewhat frequently, and you're kind of just left to fend for yourself. And that's very frustrating. Insurance also hates to cover things for PANDAS. Rituxan is, I think, $16,000 per dose. And insurance hates all of that. So definitely had issues with that. And of course with doctors saying horrible things. I also have had temporary paralysis. So I woke up one day and my legs were paralyzed. And it was about that way for a month. I had to relearn how to walk, go to physical therapy, and the doctor in the hospital did not believe me, did not believe my diagnoses or my lab work, and did misstep, and I have some trauma from that. So there's just a lot of, especially as a teenage girl, people love to tell you that it's anxiety or you're being dramatic. But like Carrie said, you know your body the best. no one can tell you what you're experiencing except for you. So my parents are great and really help me to communicate to doctors when I do have to see someone outside my normal scope of we come prepared with a list of my medications, list of my diagnoses, the lab work that backs it up, because it's not a question of if this person is going to just understand your condition. It's how much is this person going to push me that this is not a real condition, because some people don't believe in PANDAS. And so you gotta be very prepared. And fortunately, I love to do medical research. And my parents are really great about supporting me as well.
I would say that, when I was actively, seeking care a number of years ago, I think the event that was most enlightening for me was when I went to an internist, and at that point, I sort of described it that all of my blood work was normal, and the top 20, 30 things had been ruled out, and she didn't know what to do. So she because I did a lot of running, she said, well, we'll send you to a sports medicine person. And this is where I knew, where my sort of statement with regard to, I knew my body better than anybody, because I said, I've had athletic injuries before. I said, I just, these legs are not that. And unfortunately, so I went there, and I think they just thought that I was out of shape. And so they had me jump on one leg and then try to jump on the other. And I managed to stay standing on the first round, but I fell and burst into tears on the second leg. And I just remember telling them that I was going to leave, that they needed to get out of the room, and I was going to change clothes, and I left. And I think whereas I know I did the right thing by leaving, I think the tricky part about my illness, like a lot of chronic illnesses, is that they only show up at certain times. They're not on demand. And so they actually witnessed something that was very important, but they didn't know what it was. And unless you see an individual like me multiple times at different times of our day, when suddenly our symptoms show up, you're never going to see it, you're never going to understand it, and you may never believe it. And I think that's a real challenge, which led me to, when I moved and I got another primary care, or I was sort of looking into another primary care, the first question I asked her was if she believed chronic fatigue syndrome was real. And I didn't even change into my gown. And I just said, if you don't believe that, then I need to move along. And at this stage, I'm lucky enough that, again, I'm not on medication. I manage it. And she said, if you get super painful or super depressed, let me know. So she established guardrails for me, which I really appreciated. But I said, I need your help to help me age, and other things that are kind of come up as I go along, and keep chronic fatigue as the filter through which everything else will, manifest. So I had to have, you have to be that advocate, and I had to be that blunt, because if she didn't, then I needed to move on. And so it's there's definitely stigma, and I'll just end with, a couple of years ago, I broke my left wrist, and it was just so eye-opening to have something that was That was the first time I'd broken a bone or have a cast. And suddenly they're like, oh, I'll help you with this door. Or I'll show you how to do these things. And that was how people, feel when you have something that's not invisible. I was like, wow, this is a whole different, I mean, I obviously was sorry that I broke my wrist, but it was just a different experience that having something that was invisible.
Yeah, I think that having a diagnosis is a privilege that not everyone has access to, unfortunately, because of the lack of awareness around these conditions. And it is a luxury to go to a doctor and be able to give them your symptoms and trust that they will give you an answer and help, without you having to scream, not volume level scream, but feel like you are screaming, crying for help, and you finding the answer on your own and then saying, please test for this. Because I often feel like I am spoon feeding my doctors the answers to these things. So you have to advocate for yourself or nothing really gets done, which is very unfortunate, and not everyone can advocate for themselves or has someone to do that on their behalf. And so I'm extremely fortunate that my parents and my sister can help me in that, and that I am also cognitively able to do that for myself. But not everyone has access to get diagnosed, and that can be a huge barrier to getting treatment for PANS and PANDAS.
Thank you, guys. It definitely sounds like quite a lot of work to do that self-advocation, but I'm really glad that both of you have managed to do so. For our last question tonight, if people were to know just one thing about your condition in a sentence or two, what would you want it to be?
For PANS, PANDAS, there's so many things I could say, but I think the top things that I'm thinking are, we are not crazy. I don't think that anyone with psychiatric illnesses is crazy. I don't like to use that word, but that is a term thrown around at people in my position, and we are not faking it for attention, for anything, because who would want to go through this? If you actually know what it's like, no one wants to go through this. So we are not being dramatic or things like that. And when we say it's bad, it is really bad. Because I downplay my symptoms all the time and push myself through things that I shouldn't until I pass out or faint or seize. And so if I'm saying to someone that it's really bad, it is really bad.
Like Emily, there's probably lots of ways to answer this. I probably would say that our energy is something that we really take for granted, our ability to generate energy. And that I talk about mitochondria with my friends, and they look at me, they roll their eyes a bit, but they're really important. And if they don't work well, then your life is not in your control. We're not in control of a lot of things anyway, but our ability to maintain energy is lost when your mitochondria don't behave like they're supposed to.
Thank you so much, Emily and Carrie, for sharing all of that. That was kind of the end of our formal questions. But if you have anything you want to add, or if anyone has any follow-up questions, this is kind of a great time to put them in the chat or unmute if you want to ask Carrie or Emily or anything. But just from our standpoint, I really just want to give a big thank you to sit here and talk for an hour about your experiences. We don't take it lightly. We're super grateful for your sharing of your lived experience. And yeah, thank you. Really appreciate it. But if anyone has any questions, this is a great time to ask. Also on the screen, Carrie and Emily's Instagrams are linked. I highly recommend following them. I think that social media is such a powerful place, especially Emily, you were touching on it earlier, talking about how many people have really reached out to you and connected with you through social media. And that was really inspiring to hear. So I'm a big proponent of that. But if anyone has any questions, please feel free to ask.
I just wanted to say that I'm so grateful to have the opportunity to share my voice with anyone who is listening, and to be able to hopefully be a voice for those who cannot speak for themselves at the moment. And that while being chronically ill is absolutely horrible, I am so grateful to be here today, to be alive, to be able to still do some things I love in adapted ways, and just not taking your body for granted while it is healthy, or even when it's not. So I'm just very grateful to have this opportunity to share my experience.
I would echo that. This is a very powerful network that you have created, and giving platforms for individuals like us to be able to share these lived experiences, because they're thanks to social media and these kinds of organizations like yours. Then as we talk about the loneliness, then there are other pathways where you can hear and connect with others, and that is very helpful because it's validating, so you don't think that you are in those early stages of, boy, that something's really wrong, and you question yourself, and then you don't have to anymore because you have other people with whom you've been validated. So I've been honored to be part of the conversation tonight, so thank you very much for asking me to join.
Yeah, we're honored to have both of you. This has been absolutely wonderful, and we cannot thank you enough for being willing to share and speak out for what you've been through. It looks like we don't have any questions at the moment, but if anyone in the audience has any, feel free to ask. The next couple of minutes. We do want to announce that in March, we're going to be focusing on mental health and its connection to invisible illnesses. We're going to be focusing on anxiety, depression, PTSD, medical PTSD, and medical trauma, something that we have touched on today. Our first meeting, which is going to be our presentation, is on March 12th at 8 p.m. That is going to be a Wednesday. And then our guest speaker event will be March 26th at 8 p.m. and that's Eastern time, which will also be a Wednesday. And then the month after that, in April, we will be focusing on gynecological conditions, including endometriosis, adenomyosis, and PCOS.
I did have a question.
Go for it.
Hi, this is Monica. I'm Emily's mom. But I just wanted to ask the question to both Emily and Carrie, that if there's one takeaway you want people to remember when they're encountering a chronically ill person. So whether it's the, first time that you're meeting somebody and you realize that they have this condition, or, maybe it's just a friend that you've had and along the way, just because I think sometimes there are people that are unsure of what to say or what to think or what's okay to say. But, is there something that you can think of that you really just want them to know and, kind of feel comfortable kind of reaching out to you and, with a little bit of a connection on this, and like what feels appropriate for you on the receiving end?
I'll go first, Emily, since it's your mom. So but thank you for the question. I think it's a great question because I think it's built on actually something that your daughter said, that you hope that the encounter is one of empathy, not sympathy. So they're like, and I think that the first thing I would say for a person not to do is to offer, oh, have you tried X or have you tried Y? Because that is demeaning in the sense that, the person you're connecting with, they've lived it. They know what's going on and they've tried desperately to get better. And so I think that first step is really to be able to listen and to figure out one way that they can help in, checking in, or they could bring over food or do something small. But I think it's my challenge is that it's with people who have known me before I was ill, and they assume they want to. I really need people to reset that conversation in a way that, let's forget about that old Niederman, because she's there in some ways, but in many ways she's not. And I want you to be able to listen to how things are changing. And I think that's where it starts, because then they could pick up on things. So it's a conversation, it's connecting, and that's what I ask for, is just to reach out and say hello. And I'm not kid gloves. I'll tell you if I can't answer.
Yeah, I think that when approaching anyone with a chronic illness or a disability, it's important to make sure that you are being respectful in anything that you ask. And I personally really like when my friends or people that I'm becoming friends with ask me about my chronic illness, because it tells me this person cares enough to understand why I am the way I am. But just asking things in a way that's like, hey, if you feel comfortable answering, I would love to hear about X, Y, or Z. Or, hey, I was just wondering why sometimes X happens, or things like that. And I feel like, for me at least, it seems like people are often scared to bring up the elephant in the room of, yes, I have a chronic illness. And sometimes it can be very obvious. Oftentimes it's not. But it's not taboo to talk about it. And I think that just going into a conversation, establishing the intention of wanting to understand more, and letting people know that you are there for them, not just in your words, but with your actions, because actions speak louder than words. People should not have to beg you for support or for love or things like that. And oftentimes, chronically ill people feel like others forget about them. It's kind of out of sight, out of mind. If you don't see someone in public all the time, maybe you're not thinking about them, but just sending a text saying, hey, I'm thinking about you, or I saw this thing that reminded me of you and I wanted to share it. Or, hey, I'm gonna bring by your favorite drink. Because it's hard for us to ask for support. And we don't want to feel like we're begging for it either.
I would just say one other thing, spot on, Emily, that interest in, if they come back, if I've met a new person and I'm trying to educate them, I mentioned the condition, and then I'll, then if they come back and ask me some questions about it, that's even better. And on the reverse side, if I find that, somebody I've been able to, or I've shared some information to a couple of times and 3 times, and some of my dear friends joke that I have a conveyor belt that people get on. If they're 3 or 4 times, then they're not getting it, and they're suggesting something for me to try, then they're not going to be brought into my inner circle, because it's I need to be very careful about who's close, and those individuals need to have that awareness and have taken that time to get to know me and understand that, so that I don't have to keep explaining it. So it's a yes and or an offensive plan for me as well.
Those are really helpful things that you shared. Thank you so much. If there are any other questions. Also, you can feel free to put it in the chat or message Sarah privately if you have a question. But if not, that kind of concludes our meeting today. Just once again, thank you so much, Carrie and Emily. We really appreciate your time. I know I learned a lot, so thank you. But otherwise, we really hope to see you at our next meetings, and hope we can just continue our conversations.
Enjoyed sharing the space with you, Emily. Thank you.
You as well. I am glad that I got to meet you today.
Yeah.
And thank you for the Invisible Illness Network for having me here today.
Yeah, thank you both again. And we like to say to everyone, be kind. You never know what people are going through.
Yes, very true.